Good morning, viewers. Welcome to Nursing Tutorials with Jamila. Today we are going to be looking at allergic rhinitis. Rhinitis is a group of respiratory system disorders that is characterized by inflammation and irritation of the mucous membrane of the nose. Alright, so allergic rhinitis, as the name implies, it's derived from allergens. Allergic rhinitis occur as a result of exposure to an allergen. Okay, so this is the most common type of prototype of immunoglobulin E mediated disease. In allergic rhinitis, there is usually a type 1 hypersensitivity reaction to an exciting inhaled allergen, or we can say an allergic response that causes itching, it causes watery eyes, sneezing, and other similar symptoms. Okay, so let's now look at the symptoms of allergic rhinitis. The common symptoms of allergic rhinitis is sneezing. Okay, all right, then it's also manifest by running nose. Okay, then also the mucous membrane of the nose become reddish in color, and it's also associated with watery eyes and itchy eyes. Then sometimes the individual patient or client can have sweat, headache, facial pain, which is usually associated with a blockage of the sinuses. All right. How can you then diagnose allergic rhinitis? As a nurse, as a midwife, a student nurse, a student midwife, how can you diagnose an allergic rhinitis? Well, the diagnosis is usually by history taking. You take the history of the individual patient or individual client, all right? Then you conduct examination of the nasal passages. Usually you see the reddish color of the mucous membrane. You can also conduct skin testing. Now, in carrying out skin testing, you'll be able to identify which substance the individual patient is allergic to. All right? Okay, some people are allergic to pollens of flowers. Okay, some are allergic to other substances. So when you carry out skin testing, you'll be able to identify which substance the individual is allergic to. You can also conduct blood testing. Now, in blood testing, you can be able to identify, or it will show you the level of immunoglobulin E in the body. So this is pertaining the diagnosis. All right, let's look at the pathophysiology of allergic rhinitis or rhinitis. All right, now since allergic rhinitis occurs as a result of exposure to allergen, so once the body is exposed to these allergens, okay, the body produces an antibody. Okay, the antibody is called immunoglobulin E antibody. So the immunoglobulin E will now try to attack the threat that is brought by the allergens. Now, once the immunoglobulin E is produced, it will send a signal to the mast cells, and these mast cells are usually present in the skin, in the lungs, in the nose, and also in the blood. So the chemical signal sent to the mast cells will now stimulate the mast cells to release histamine that is present in the granules. All right, in the cytoplasm of the mast cells, usually it contains granules. Then inside of these granules, we have what we call chemical mediators, in which histamine is one of them. Okay, so once immunoglobulin E send a chemical signal to the mast cells will release the histamine, and then histamine will now increase blood flow. It increased blood flow to the sites that is affected by the allergens, and as a result of this, it's usually inflammation. Okay, the inflammation will allow other substances from immune system to step in. They try to carry out their own functions. All right, that is the repair work. All right. Now, the histamine that is being released then will now clock at special places that we call receptors. It fixed itself into these receptors, and before you know it, it will prompt the mucous membrane to produce more mucus, and that is why the individual begin to have runny nose and then stuffy nose and sneezing also. Individual also coughs as a result of the increased production of the mucous membrane. Okay. Now, in a nutshell, in the pathophysiology, what I'm only trying to say is that there is usually production of immunoglobulin A, that is an antibody. This antibody is produced by the body itself as a result of the exposure to the allergen. And we said the immunoglobulin E send chemical signal to the mast cells, and then the mast cells will release histamine, and the histamine will go into circulation and increase the blood flow. So once there is increased blood flow, there is going to be inflammation, and then the inflammation is the one that will make that it causes vasodilation. Okay, there will be vasodilation, and before you know it, other substances from the immune system will come in. And why are they coming in? They are coming to do the repair work. So the histamine will now fix itself into the receptors, and this will now result to the increased production of more mucus, and hence the nurse begin to runny nose, and the individual continue to sneeze and coughs. So this is what actually happened in allergic rhinitis. Okay, let's look at the risk factors associated with allergic rhinitis. Now, in the risk factors, we have genetic, that is, an individual can be able to, it runs in the family, the individual can inherit it, okay? If a mother or father have allergic rhinitis, there may be every possibility that any of the siblings can also have allergic rhinitis. All right. Another risk factor is gender and age. Usually before adolescent, the female are more affected by allergic rhinitis. All right. Then we have birth date. Okay. That is those people that are born during high pollen season. Then exposure to cigarette smoking. Exposure to cigarette smoking is a risk factor to allergic rhinitis. Then you can also have other allergens, or even asthma. Okay, it's also a risk factor. How can we then prevent allergic rhinitis? Since it occurs as a result of exposure to an allergen, then avoid the exposure. Avoid exposing yourself to an allergen or anything that you are allergic to. Okay, you can also keep your windows and doors of your house closed when there is high pollen count. All right, then do not have flowers inside the house. Oh, I know how difficult this will be because we love flowers. They are beautiful. They make our homes look nice. All right, but we should know the type of flowers we plant in our houses. We should plant flowers that have lesser pollen count. Okay, then keep away from cigarette smoking. You can also smear Vaseline around the inside edges of the nostril, as it helps to stop pollen from getting inside or getting through the nostril. Thank you very much. If you like this content, please remember to hit the like button and subscribe. Thank you.